welcome. This is NTA Tuesday Live and I'm Cyril Stober. Tonight, we'll be dwelling on vaccine hesitancy, status and the deadline. Nigeria in March 2020 joined the rest of the world in a lockdown and imposed restrictions on the movement of persons and goods following the declaration of coronavirus as a global pandemic. Now, scientific research paid off months later as a vaccine to boost the immune system against the virus was developed, produced and distributed to countries to first cater for vulnerable persons with a target of covering a larger population by 2022. Now, Nigeria took the lead in Africa with huge deliveries and allocation of different brands of vaccines to states. But several months later, the response to vaccination has declined. Can it be hesitancy, or is there more to this reaction? As the 1st December 2021 deadline for federal civil servants comes into effect. Tonight, Tuesday Live, we'll be looking at COVID-19 vaccine hesitancy status and the deadline for federal workers to be vaccinated. But first, let's get to see this report by Salwa Khalil Ibrahim.
Is still battling with COVID-19, with more than 5 million fatalities recorded, according to WHO. More worrisome is that the virus is mutating into deadly variants. Most recently is the Omicron variant, first detected in Botswana, which has now spread to South Africa and other countries, with Nigeria at high risk. Meanwhile, as part of global response against the pandemic, in March 2021, Nigeria was able to access and deploy vaccines, among other measures, to protect its citizens against the dreaded virus. The target is to vaccinate 70% of eligible population to move Nigeria toward attaining herd immunity by 2022. But so far, only about 6 million eligible population, which stood at 5.4%, have been vaccinated, a far cry from its target.
Government remains conscious of its responsibility to safeguard the health of our people.
We need to aim higher than 70%. To be more assured of protecting the health of most Nigerians. But this ambition can succeed only with mass mobilization and participation of citizens.
We should not be concerned about the availability of vaccines because the supply chain has been analyzed and we're confident that the vaccines that are required to vaccinate this federal government employees and even more than these specific numbers of government employees has been figured out.
Despite the availability of the vaccine across the country, misconception and vaccine hesitancy cannot be unconnected to the downturn of vaccination exercise.
They say he's taking iron, he's magneting this. But on proper consideration of this thing, and now look at it, would the government decide to kill the citizen? That's not possible.
The federal government launched the COVID-19 mass vaccination campaign strategy and have declared December 1st as deadline for all civil servants to show evidence of being vaccinated or negative test result before being allowed into their offices. Are civil servants ready?
I'm in the process in doing that. I haven't just been vaccinated.
I'm happy as I take it, so to protect my life.
Since it's for the prevention of COVID-19, so I think it's good.
Vaccinations, however, remains the most potent weapon against the pandemic. And like they said, no one is protected until we are all protected. Salwa Khalil Ibrahim.
All right, that report sets the tone for tonight's discussion. Let's introduce our guest to you. We'd like to welcome to this program the Minister of Health, who joins us via Zoom, Dr. Osagi Ehaniri. Minister, thanks for being part of tonight's discussion. Let me also welcome to this program Dr. Mukhtar Mohammed, Technical Head, Presidential Steering Committee on COVID-19. Thanks for being here with us tonight.
Thank you. Much pleasure.
We're also joined tonight by Dr. Neka O. She is Director, Primary Healthcare Systems Development Department of the National Primary Healthcare Development Agency. Thanks for being here.
Yeah, thank you.
And we're also joined via Zoom by Professor Oyewale Tomori, renowned virologist. Prof, it's good to see you on this program. Thank you. All right, we always acquaint you with the procedure of this program. At the appropriate time, you can get to be part of the discussion in the studio. The phone lines will be on your screen. You can take advantage of those and call in to ask a question or air your views, but that would be at some point during the program. We'll tell you about it when we're set to do it, but just to quickly remind you, as we always do every week, at the appropriate time, if you do call in and your call gets through to the studio, remember to turn down the volume of your TV set to avoid the hurlback or the echo. And we always encourage those who call in to go straight to the point, ask a question or make a comment, and not bother too much about the greetings. So welcome to NTA Tuesday Live. Tonight, it's all about the COVID-19 vaccines, the hesitancy, and how all those federal workers out there must show proof, some proof that they are vaccinated or they have had a test and they are COVID-free before they get into office. So let's start first by going over to the minister. And Minister, since the distribution of the vaccines and the drive to get Nigerians vaccinated, what can you tell us about the numbers now? Just update us about the number of Nigerians that have been vaccinated and the number of vaccines that are available for people to be vaccinated.
Available, if we make a call for it, up to 100 million, which are on offer, doses of vaccine. Not that all the 100 million are here with us in Nigeria, because of course there will be issues of storage and issues of expiration. So we call for the vaccines, but we can call for up millions. So at the moment, we have enough vaccines on ground to fill our storage capacity and to dispense to all the states. Now, the thing is that we have in our system a health system that has to translate everything you are doing to the implementing partner, which are the state governments, and sometimes, in fact, the local governments. The vaccination actually is something that's done in primary healthcare. It's done by local government care workers, but for this particular purpose, all hands are on deck to get that process going, and we have the responsibility also of encouraging the states to work with us. If a particular state does not work with us, we have issues. The nature of our constitution is such that we must, it is onto the states after making the preparations and the policy.
All right, Minister, by your assessment, obviously you do receive updates from the states on what the situation is like. Well, if you were to assess the percentage of those who have been vaccinated in this country, where would you place it?
Well, we are like around 6%, and of course that is not uniform all over the country. There are some states that are doing very well. Others are not doing very well. I do not want to, right at this point, start naming names, but we're encouraging all the states to come up. We're also coming up with the strategy of allowing the private sector to join, private practitioners to also start offering the vaccine, which is going on already in Lagos. It's going on very well, and to supply clinics everywhere. Many of the ministries, many of the government workers have staff clinics. The staff clinics will be offering the vaccines, and also company clinics will be getting the vaccines to give to their staff. So all the companies who have their own hospitals or their own staff
clinics or company clinics will get vaccines for their staff. So there is no shortage of that. There are also, if you have mobile vaccination units that are going around, you have seen them in Abuja, and they're trying to raise direct awareness and offer this service even in near the markets, at mosques and churches. That's part of our strategy to starting the mass vaccination. For this, we work with the states. In the case of Abuja, is the Ministry of Federal Capital Territory, and this awareness, as we are doing now on this program, we'll come on this program to also use it as an opportunity to raise awareness and assure citizens that this vaccine is necessary to protect lives, and it hasn't got any of the fears that have been injected into the taking of this vaccine by social media particularly.
All right. Thank you. Thank you very much. Back here in the studio, Dr. Mukhtar Mohammed, what has been the response like since the first, it was a presidential task force, now translated to the Presidential Steering Committee on COVID-19. What would you say has been the general response of the populace?
Generally, I would say that Nigerians are sensitized. They have come to understand that COVID-19 is real. I will say that Nigerians are aware of the ways to protect themselves from COVID-19. We've been monitoring those polls over the last 18 months or so, and we've seen the progressive rise in terms of awareness and also knowledge regarding COVID-19. However, we've also seen that that knowledge or that sensitization has not really translated into action. Because as your reporters have shown on several programs, that you go to public places, you see that people are not wearing protective gears. You go to institutions and you see more than the prescribed number of people gathering in the same place. You go to places of worship and you see flagrant disrespect or abuse of the COVID-19 protocols. You go to our transportation sector, motor park, markets, and many places, and you see that only few are complying. Nigerians are aware, but they have not translated that knowledge into behavior. In terms of vaccination, people are aware that vaccines are being provided everywhere. We've seen from the polls that over 80% of Nigerians are aware that the federal government is providing these vaccination programs. But the uptake of the vaccines itself has been quite abysmal. We know that it takes time, not only in Nigeria, but in many other countries. But really, we need to move on from where we are. And that is why what we say is that it is not the responsibility of government alone. Everyone has a part to play. Like the Honorable Minister mentioned, the state governments are the implementers in the states, but we also have the private sector, we have the traditional institutions, the religious institutions, and other community gatekeepers. So generally, the response is kind of ambivalent, I would say. There are good parts, and there are also other parts that we have not done so well.
Okay, we'll explore the reasons why people have knowledge, yet they are slow to action as we go on in this discussion. But let's come to Dr. Nick. Let's say, well, the National Primary Healthcare Development Agency has always assured Nigerians that these vaccines are safe. Now, the knowledge is out there. So, vaccines are safe, they are available, the numbers are not coming forward.
Yes, thank you very much for that question. And I think from the Honorable Minister and also Dr. Mukhtar, it's obvious that the knowledge is there, but people are not coming. But we've seen a steady increase, and possibly because of the way we started. We started with the phasing, with the amount of vaccines we had, 3.9 in March, and we targeted the healthcare workers, the frontline workers, and we continue to expand. And that was limited to our public facilities. Now for this phase, which is a ramp-up phase, we have expanded. And if you hear, most of them are aware, but they don't know where to get the vaccines. And that is why the expansion is very important, and we've seen a steady increase. In the last few weeks, quite a huge jump across the states, because not only in FCT but across the 36 states plus FCT where we're having mass campaigns. So the mass campaigns take the vaccine to the parks, to the markets, to the private facilities, to our pharmacies, to the university. I'm sure you saw when Nance came also to our office, met our executive director, that through the press conference we normally have every week, to declare that they are also available, and we are taking the vaccines to the universities.
We started off with AstraZeneca, and now there are other vaccines. Take us through the vaccines that are currently in use in Nigeria.
I think that Nigeria is very lucky. Maybe the leadership we have, and those are the Presidential Steering Committee. Unlike other countries in Africa, we have quite some of the vaccines, at least 4 of them. We have AstraZeneca, we have Moderna, we have Pfizer, and the Johnson & Johnson. And these are the vaccines we'll be receiving through the COVAX facility, as well as through the African Union. So currently, as the minister said, we do have enough vaccines to take us to that 50% that we are targeting by January 31st.
Okay, and all these have been approved for use by Nigeria.
Oh, yes. We normally would go to NAFDAC. NAFDAC would do whatever the evaluation is and then certify them before we start using it.
Okay, we'll talk about who should take what and some of the issues surrounding the different vaccines. But let's go over to Professor Tomori and say, well, Professor Tomori, at some point in time, now we're beginning to get to the stage, when the public awareness started, initially there was a hesitancy, and that's about COVID, the existence of COVID itself. And then after a while, Nigerians began to believe that indeed COVID was real. And at that point, it would seem as if there was a peak. And after the very first period, it now seemed as if so many Nigerians now started feeling, oh well, the worst is over and COVID is gone. What are your thoughts about that?
Thank you very much, Cyril. The issue about vaccine hesitancy is a global issue. It's not just in Nigeria alone. And I think when the whole issue started, NTA, CDA, we all got involved in creating awareness to people that this is a major problem. We need the vaccines and all that. I think part of the initial problem was that we're facing a lot of misinformation. Perhaps I would feel that perhaps we're not active enough in countering those misinformation as they came along. We allowed some of this misinformation to settle down before we attack them. I think this is a lesson for future. Anytime any misinformation comes, I think go straight at it and attack it with facts and figures. I think that would be one thing we should need to do. The issue of availability of vaccines also becomes a major issue. After you've encouraged your people, make them aware, then you should make those vaccines available. We had a little bit of problem with that at the beginning, but things are improving. And I believe that with more of this type of awareness that we're doing, more people will get into the collecting the vaccines. I think one of the things that we need to, initially, I was not in full support of mandatory. My reason being that if the vaccines are not available, you cannot mandate people for what is not existing. But now we have assurance that the vaccines are available. And all those who are refusing to take it should be told that for their own sake and for the sake of others, they should be able to take those vaccines. And that's why I think I supported the idea of the mandatory nature, particularly in the fact that government provided the vaccine and also gave plenty of time for people to take it. It wasn't as if tomorrow you must be vaccinated. I think it was almost about 6 weeks or more in which we done. So anybody who has not been vaccinated at them, I think he has a problem in his hands.
Prof, I'm just thinking here, the vaccines are there, people have been encouraged to take them. But how do you respond to the feeling, especially around these parts, that yes, COVID is real and it's been wreaking havoc all over the world, but for some reason, the numbers in this part are not as high as what we're seeing in other places. So it would mean that COVID doesn't strike that hard in this place, and therefore people can be complacent.
I think the error many people are making is that we are focusing on death as the outcome of COVID. Because we're not seeing many dead people who say, oh no, the thing is not there. But studies have shown that people are infected. A lot of people, 60, 70%, will show the infection and will not show the disease. Those are the asymptomatic ones. And those are the dangerous people in terms of the fact that they don't know they are sick and they are busy spreading the thing around out of the fact that they don't know. Perhaps testing, if it had gone beyond just people who are sick reporting for testing, would probably have shown us that there were many more people who have been infected. I think the committee that the minister set up had done some surveillance and is showing that quite a large number of people have been infected in this country. During the first wave, we had almost around 20%. I think Lagos are the highest. During the second wave, we are getting figures like about 40% of people infected. And during this last wave, our figures are going to about 60 to 70%. So people are being infected. It's just that people are not dying. And we're grateful for that. But we should not take that as an excuse for assuming that the problem is not there. It is there. We're just lucky now. And again, it also depends on which variants. We don't know which variant is coming next. And we don't know what it's going to cause. So people should get themselves protected rather than expose themselves to danger. And I think that's the message we need to keep telling our people. This is a virus which is evasive, elusive, and I want to say one of the smartest viruses we have around. And it's shown itself for what it is. Now the strains are coming. We don't know what is going to come out of it. We don't know where the next strain is going to come. So please get yourself prepared, because you don't know what major thing is going to come with the new variant. So please get prepared and get vaccinated.
All right, thank you, Prof. Dr. Mukhtar Mohammed, the government came up with a deadline for federal civil servants to either get vaccinated before 1st of December, because they'll be required, which is, yes, just a few hours from now, or show proof that they have undergone a PCR test and they're COVID-free. That didn't go down well with quite a number of people who felt that might affect so many things. And how did you come about this decision? Let's start from that premise. And
yeah, so I mean, it is only reasonable that you take control of your own immediate environment. Government cares about the safety of the federal workers. They want to assure everyone that if you come to work, you will feel safe. You will not have the fear or the trepidation that you will leave your work with COVID infection and go to your family and then spread it. Right. So all this government is doing is to make sure that the work environment is safe, that if you are vaccinated, you come to work. You don't have the fear that your colleague or your neighbor who is unvaccinated can pass that infection to you. Because even if you are vaccinated, you can still get infected and you can still spread the infection. So that is it. I think there is nothing beyond that. The motive of government is to make sure that our workspace is safe and secure. And the federal government has to lead by example. The government has to show that to the private sector. They have to show that to the state governments, to the local governments. They have to show that to private individuals so that everyone can take control of his environment and do the needful. No one wants to take infection back home.
Right. Now, are you thinking about the logistics of carrying this out? And someone says, let's look at a scenario on the first day of December, which is actually tomorrow, and civil servants turn up in their various places of work, and they are expecting to see a crowd of people at the entrance because everyone needs to display some form of proof that they're either vaccinated or they're COVID-free. Wouldn't that in itself create a scenario where, either affecting the work process or even be a source of spreading the virus further?
Well, from the announcement is if you are not vaccinated, you are not allowed to enter. So I do not expect people who are not vaccinated to turn up to work tomorrow. because the instruction is there. The head of civil service has issued that directive. The MDAs are all aware, all the ministers, the heads of agencies, they are aware, and each one of them is responsible for setting up this system, in their places of work. I believe they are all consulting right now with Primary Healthcare Development Agency, and also setting up their own teams who will monitor that. I do not expect to see a large crowd because it should be a seamless process. Okay. You have a vaccine certificate, you show it, the QR code is scanned, and it will show that it is genuine, you pass. It is the same procedure as like when we do the sanitization. If you are going to enter any ministry, someone will take your temperature and someone will press the sanitizer on your hand. It doesn't take longer than doing the sanitizer or taking the temperature process. So certainly we do not expect to see long line. But initially, maybe there may be some hitches and glitches at the beginning, but I think as the days go by, the system will be perfected.
Okay, we'll return to so many other issues. But let me say that we've been joined by another of our guests, Professor Hawa Evelyn Yusuf, who is a criminologist. She joins us via Zoom from Kaduna. Professor Hawa Evelyn Yusuf, thanks for being with us on NTA Tuesday Live tonight. Thank you for being with us. And straight off, if you can hear me, let's talk about the response to COVID. Now, COVID, apart from its own health challenges, it came with a lot of baggage, and it's now a social problem. It's just gone beyond just health alone. And we all saw what happened during the lockdown and what's been going on. People taking advantage of the situation. What do you have to say about that?
Good evening, Nigeria. I'm talking about what COVID brought and how Nigerians have been able to try to take advantage of situations and try to adjust to the new normal. I think COVID came, everyone was scared. We were asked to take precautions. We started taking precautions, and to a very large extent, every Nigerian has come to realize the fact that, well, COVID is here, and that there is a way we have to live now other than the way we lived before. And people have gotten used to using their face mask. People have gotten used to sanitizing their hands consciously, unconsciously. People carry sanitizers about, and so on and so forth. Yes. And then came the issue of vaccines. And then now a lot of Nigerians are taking the vaccines, and just as a lot of Nigerians are still refusing to take the vaccine, perhaps because of one thing or the other. But I can assure you that COVID itself is a social problem.
All right, we'll return to you in a moment. But let's come to Dr. Onwu, who's here with us. We've listed about 4 different types of vaccines, and we are told all these vaccines are efficacious, they're effective. They can provide the much-needed booster to those who are taking it. Now, at the initial stage, some people were a bit confused. Should they go for AstraZeneca? Should they go for Pfizer? Should they go? And there were all kinds of issues going around about these vaccines. What is the state now? And for those who have had the first shot, is there, can, for instance, one who started off with AstraZeneca now take the second one as Pfizer? What's the state of it?
So I'll start with the last one. The advisory we have now, we're not mixing vaccines for now. So for Nigeria, you take AstraZeneca, you take the second dose, which is also AstraZeneca. And we have Pfizer, we have Moderna. I think people were reacting to what, disinformation and misinformation. So much was going out there. People were hearing a lot that people would take this one and fall and die, that this vaccine is good and this one is not good. But they've seen how many billions across the world get vaccinated with these vaccines. And they know even within the country, when they say it will light up, and all that, we've demonstrated that doesn't happen, all that misinformation. And what I've found, especially in the communities, is that they need information, and it's not, it's one-on-one. They ask about this vaccine, what is it, and how does it help me? And if you explain everything and nobody's falling and dying, they are taking it. So I think the vaccines are there, they are all efficacious, and we are using them, and it's being used across the whole world. There is even more than these ones that we have that are being used across West Africa, across Africa. So they all have how they work, but they are all the same, and they're efficacious and against COVID.
All right. We have a number of reports. Let's start taking the very first from Lagos, and this one is by Annie Daniels.
As the coronavirus continues to mutate to more dangerous variants threatening human existence, government is working assiduously to ensure herd immunity is achieved through making available vaccine to the public. The Lagos State government flags off the Count Me In 4 million Lagosians vaccinated against COVID-19 campaign with the aim of vaccinating 4 million residents before the end of 2021. To achieve this, it is partnering with the private sector to ramp up the process of vaccination.
And what you can see here is 225 public facilities where the vaccine is available per local government. And we've just recruited 135 private facilities, making a total of 360 where this vaccine can be obtained as of now. This is the current state of the accredited vaccination centers.
With a series of enlightenment campaigns about the importance and safety of the vaccine, some people have taken the bold step to be inoculated.
If you choose to be vaccinated, you go to the national portal, which I will show you in a second. You go into the portal, you give us your details, and you have an option to go to a public sector where the vaccine is administered absolutely free.
Even with people already vaccinated without any record of adverse side effects, there are some who are still holding onto the myths surrounding the various conspiracy theories.
Some will tell you when they travel, they take it. You understand me? So I wonder why they don't want to take the one they brought here for us.
With the detection of Omicron, a new COVID-19 variant with high number of mutations that have been declared as variants of concern by the World Health Organization, experts are advocating full inoculation as a way of defeating the virus. And while we wait for that to happen, Nigerians are still advised to ensure that they maintain all safety measures put in place by the World Health Organization.
All right, Annie Daniels in Lagos. We have another report, this time from Kanu, and this one is by Elizabeth Yila Lamidu.
The first batch of COVID-19 vaccines arrived Kano on Tuesday, the 9th of March this year, and was received by the State Commissioner of Health for onward distribution. With 138 centers, more than 200,000 people received the AstraZeneca vaccine in the first phase of the exercise. Then the Moderna vaccine was introduced during the second phase of vaccination. With 149 centers, so far, 138,000 persons received doses of the vaccine. This is one of the COVID-19 vaccination centers located in Muhammadu Abdullahi Wasi Teaching Hospital, and currently there are about 6 persons in queue to be vaccinated.
We vaccinated 1,300 clients. We started Moderna in August. Then we vaccinated 350 clients from August to date.
Some of the people vaccinated have this to say.
I think it's important, and I'll continue
telling people and educating them about it. There should be this awareness, creating more awareness for our people. Nigerians are very careless people. They just believe once they're sick, they go into the chemist, give me this, and they take off, they go. But something is inside there eating you up, you don't know.
While our population is huge, but again, the supply of the vaccines to Kano State is also very minimal, considering the population of Kano requires a lot of logistics.
In a state with a population of more than 30 million people, barely 500,000 were vaccinated. This goes to show that there is a long way to go before achieving the federal government's target before the year rounds out.
All right, let's return to the minister at this point in time, Minister Dr. Sagie Haniri, who is joining us via Zoom. And Minister, let's talk about this directive to federal workers. In a few hours from now, they'll have to present some form of documentation to show that they've either been vaccinated or they are COVID-free before they're allowed into. Do you envisage a situation where so many would decide, well, not to show up and say, well, I haven't been vaccinated, and or I'm expecting the results of my test, so they stay away from work?
Yes, I do believe you have a good number who are doing that. Who will do that? Who will say, well, they don't have a vaccination yet, so they will stay at home, or they will try and get it somewhere, so that it doesn't show on their record how many days they have not showed up for work. But I also expect that they who will come to the staff clinic, because both ministries have a staff clinic, to come and get their vaccine, or at least the first shot, those who are hesitating. And those who have received the first will probably come in for the second. But it's a global problem. The hesitancy is global. There are countries where, in fact, there's been riots of those who absolutely refuse. They believe there is a right to decide whether to take it or not. But it's a way of in the population, what herd immunity is, protecting the population, getting 70% by placing these kinds of conditions. There are countries which I myself have seen, where you cannot even go into a restaurant, a private restaurant or a private store, and they will ask you, please show me your COVID vaccine card before you can come in here and sit among our clients to eat. And of course, you know, all abroad nowadays, airlines already ask you for your vaccination so that you are not a threat to others. And then I do envisage that sooner or later, even domestic airlines will still be asking you for your proof of your vaccination. So it's in the interest generally of the populace to take these vaccines, because sooner or later, somewhere, you're going to find yourself excluded if you are not vaccinated or cannot prove that you have got a vaccination. You cannot continue doing tests, because your test has a limitation in value. So you can do a test every 72 hours. You get tired of it, and the vaccine will definitely now give you better access to public places.
Well, I was going to say that some people will be test wary if they have to every 72 hours do a test, and it's not as if the PCR test is the easiest of tests to do, really, Minister, is it?
Exactly.
Okay. All right, Dr. Mukhtar Mohammed, we're back here with what is going around in so many parts of the world, and we're not left out. But we've been told that we're not thinking of any lockdown again in the manner we saw in 2020, are we?
With the emergence of the new variant, I believe some countries were hasty in taking that decision. There are a lot of things we don't know about the variant. Yes, we're afraid, we're apprehensive, but we have learned a lot over the last 1 year in dealing with COVID-19 variants. You recall that the Delta variant, when it emerged initially in India, and was spread around, many parts of the country, there was apprehension and there were several steps that were taken. We in Nigeria here, we took some proactive measures, which were really restricting passengers arriving from certain countries and revising our protocol so that we accommodate those measures. We only succeeded in slowing down the entrance of Delta variant into Nigeria. And now we have learned that if we are to impose those restrictions and tighten them a little, and heighten our surveillance and identify potential risks, people coming from those countries, we can actually achieve nearly the same result without having an impact on our economy. When we restricted India, South Africa, Brazil, and Turkey, there were consequences. We succeeded in delaying the virus, but there were several economic consequences which Nigeria suffered. Now we feel, we are confident that we can actually refine those restrictions, which is what we are doing now, strengthen them, tighten them, heighten our surveillance, and achieve nearly the same result. And we are going to begin that by Friday, December 3rd. That new protocol is going to come into consideration.
Okay, let's look at one or two other matters here now. From the National Primary Healthcare Development Agency, those certificates of being vaccinated are issued by the National Primary Healthcare Development Agency. But then there are now issues that some people might bring fake COVID vaccination certificates. In fact, it's been reported, and we would like to know what's the update on reports of people who acquired certificates somehow without having been vaccinated.
Yeah. It's really unfortunate that it's happened and it's happening in our country. And of course, when we had that, you had Professor Tomor in terms of stepping up immediately with the advisory from the Presidential Steering Committee, the Honorable Minister of Health, our ED, we've gone ahead to also take measures in terms of how do we stop this in its tracks. One of it is to have a joint task force that has all the security forces with us. I'll just not name them, but they are part of it, and they're across the states and in the communities as well. And we have identified these people and they are being persecuted. But we've also gone ahead to step up on the card and have another, symbol, something that will indicate when you scan it that the person got it fraudulently. That I cannot talk about, but we had to take that step immediately. So we've had reports and the people and actions are being taken by the relevant bodies. And that's what NPHCD has done.
For those who were truly vaccinated and who obtained their genuine cards, there are features on those cards, and they can be confident that if they present those cards and they're scanned, there won't be any issues whatsoever.
Definitely there will be no issues, because that particular data will be uploaded into a central platform that will indicate that it's true. These other ones that come by the back door, you will know. Even when you scan, something will be missing. And definitely if you go to scan them, go to the central data, it will be missing, because the people who do this not go all the way to finish up what they need to do. But we've stepped up in putting up something we call validation, which will also go ahead to validate these cards to show that they are genuine and the people who are really vaccinated. And we've actually expanded the size. People know where to get the vaccines, and we're encouraging people to get vaccinated and not buy the card.
Okay. Professor Tomori, if you're still there with us, this variant, Omicron, that's out now, and people are expressing worry over how it will be. Countries are beginning to take steps, and some feel that there is a rush to just shut out some parts of the world when everyone still agrees that not enough is known about the coronavirus itself, not to even talk about the variants that are coming up. You think some countries have been too hasty to slam the doors shut for cases that have been discovered? That's one side we'd like you to talk about. And the second part of it is there's also talk about some form of discrimination going ahead. A country might say it has discovered through testing a variant. Now, does that mean that that variant is indigenous to that country?
Thank you very much. Let me start with the last one. Discovering something, it requires much more than that. And that we talk about travel history. You need more information to determine the origin of whatever. Let's take the situation that occurred with the current Omicron. This situation information we had was that there were 4 diplomats who went to a meeting in Botswana. It was there they detected. So in actual fact, these are people who came from South Africa itself, not from Botswana. And when Botswana did the study, they then found that this was slightly different. And then they called assistance of the South Africans, who then came up with this Omicron. But also at the same time, they discovered that in Gauteng province, that this has been surging. So really, I mean, if you do your proper scientific study, you can pinpoint where the origin of the virus is. You remember there was a time when we were having polio outbreaks in Nigeria, and then they were discovering polio cases in as far as Indonesia, Hong Kong, all those places, and found out, you could trace the origin to where it comes from. So science is good enough to let us know, but you must get all the facts. What are the travel history? When did they arrive in the place? How long have they been out of the place? When did they come in? Take the issue with the Canadian thing that said they found some Nigerians, with positive. It is in our position for us, I mean, a matter like that, to have immediately contacted the Canadian government or the travel agencies to find the details. Where did these people come from? What is their travel history? Did they actually start from Nigeria or did they come from somewhere else? That's the only way we can begin to say, is this something that originated from Nigeria or somewhere else? And that's why it is important for both the PSC and everybody to go beyond just listening to what is on there. Contact the Canadian agency, the travel agency, and all that one. It's within their right and within their power to do that and get the right information so that you clear off the situation, whether it's already in Nigeria or it's not in Nigeria. That's the first the point. I'm trying to remember what was the second question, the first one you asked. Hello, sir.
Yes.
You asked me whether the country were hasty in setting up this. We cannot eat our cake and have it, as people say. When the whole issue first of all came out from China at the beginning, people condemned China for not, for people not having travel bans or those of that nature. People say travel ban doesn't do anything. I don't think that's true. Travel ban gives you a little bit of time to sort out yourself. It allows you the scientists to get more information and you to prevent any other problem coming into your country. You hear something is coming into your country, you prepare for it. That's precautionary. It's different from panic. And look at the situation that has happened when they banned or when they put travel restriction. I don't want to use the word ban. When they put travel restriction on those companies, that was within their right as a country to do. I know all WHO regulations is supposed to be adhered to, but there are guidelines for countries to look at their own situation. And I keep asking that question, if situations were reversed, supposing, for example, Africa was West and West was Africa, and you've gone through the problems they are getting with all the vaccination, with all the deaths that's occurring, with the Delta that is rapidly upon them. Now they're having Omicron. What will be your first reaction? You want to protect your people. So in a way, we have to also put that for their own sake, that they have a duty to protect their people. So whether it's hasty or not, they have a situation in which they're having a place. We've not gone through the situation they've gone through. We didn't have all the kind of problem they have. So these are countries that have gotten Delta, they have gotten deaths, they have gotten vaccines and all that one. And yet, there's something new. So they must, put something on a kind of travel restriction. We did that for India, didn't we? So why are we saying that, all those countries are being hasty? I think we should give it for each country to look at their own situation in their country and take a decision based on that.
Prof, the reason I'm bringing this up is there's somewhere I'm going to. For instance, the first aspect of it is once a variant is discovered, and it's discovered, a country says we have discovered that. With what is happening, might that not lead to a situation where some of the countries another variant shows up tomorrow somewhere else in the world.
Let me go back to the video about viruses and diseases. Before, they used to name them according to location, but that became improper. Now you're naming Omicron or River or something. Well, let me start with our own situation in Nigeria. Lassa fever was discovered in this country in 1969, and it got the name Lassa. I mean, if we're not using names, people have used different things. But studies later showed that way back in 1952, missionaries who were working in Sierra Leone had Lassa. But at that time, it was not discovered. And therefore, by the norms and the conditions of naming diseases and things, we were only following what was right. I mean, you get the name, you get the fame, you also get the shame, if there's any shame attached to it. That's the convention. So you can't turn around now and say, because I caused it first. And any country that decides not to tell its own or say they have it, they will suffer it. The fact that you didn't tell me does not mean it does not exist in your country. And if you deny it and the thing is killing your people, you have to come up one day or the other. But in any case, I don't think it really matters, whether whatever it's, and that's why I think WHO has used Omicron, all this kind of thing. And that's why I talked about the issues of travel history. Take one of the vaccine, the variants, which we are calling Nigerian variant. When you check the records, it was first found in Angola. That was the report. So it's also the state of your own development that determines how quickly you find. South Africa is far ahead of us in this area. So they find, who knows, it might have been here, we don't know. But because our system is not detecting it, then we take that on. So that's the point I think we need to look at, as far as the situation is. Whatever WHO convention is, it is left for a country to make up its mind on its own part. But there are certain conventions about this type of thing. You discover it, you get the name, you get the fame, and you also get the shame. We can't separate the three.
All right, we'll return to other issues about that. But Dr. Mukhtar Mohammed, again, we have seen that the hesitancy is for so many other reasons, despite all the advocacy and the awareness that's been going on. But let's take the federal capital city, Abuja, itself. You walk into many places. In fact, I'm saying this, and you find that just about 80% they have dropped down their guards. In fact, health institutions, hospitals, clinics, you walk in there and you see no one is observing any COVID protocol.
Actually, that is one of the trepidations that we have. And because what we see with the new variant, we know that if your population is largely unmitigated, if your population is not vaccinated much, it means that the virus has somewhere to call a home. Okay. The virus will stay in that population, it will find vulnerable people, and it will grow and mutate in those individuals. And from there, you will see new mutations, new variants springing up. Now, that is why we need to overcome this hesitancy. That's why we need to make sure that people accept these vaccinations and you get vaccinated. And apart from the vaccination, that people have to be alive to their own responsibilities to make sure that you are protected when you get into public places.
Let's go back to the Minister of Health. Minister, as you push for federal civil servants to be vaccinated, it's an issue I just raised with Dr. Mukhtar Mohammed. You go to hospitals, including government-owned hospitals, federal government health institutions, and people are not observing any of those protocols whatsoever. I've seen these myself. What happens to those health institutions? So if the people say, well, even if hospitals themselves no longer enforce the protocols, why should the general public bother?
Well, that's a very good question. But again, as I said, that's a problem you find in most countries. If you look at international news, the other day I saw people who went even beyond refusing masks to fighting the police and wanting to enforce their rights and go into places where they have been banned from. But I agree with you. There is a very odd behavior pattern you will see. I have confronted many people, even around my office, and I say, why are you not wearing your mask? And they have their mask is in their pocket. So they bring it out of their pocket and put it on. And you're coming back down, you meet them again, take it and put it in their back in their pocket or in their handbag. So I think there's a certain sense of either fatigue or overconfidence or thinking that, well, I will not be affected, or they have prayed over it. There's probably some fatalism that is attached to it. And but I think the answer will be that those who do not have proof of having gotten the vaccination will somehow or the other face some penalty. They're compelled to take it. But as far as compliance with the non-pharmaceutical interventions, or at least the public health measures are concerned, you will likely find less and less and less adherence. There are other countries where there is a lot more social discipline, where we say, yes, we have all decided we need to put on masks, we need social gathering, social distancing, and therefore, so once we have all agreed to it, we must all do it, and everybody comply. But here, our minds don't work that way. Some people think, well, more than one in 2 or 3 think they can get away with it. So they just do exactly the opposite of what they're advised to do. It's what you see in many places here. Over.
Okay, Dr. Nika, let's look at how look at what's happening in the rural areas. Well, it might be relatively easy to keep an eye on the cities, the big cities like Lagos, Abuja, and the rest of them. What about the rural areas? Has this message permeated down to the rural settings that vaccination is necessary, you need to be vaccinated? And what about data coming from those places?
So the good thing that we've had the platform at the NPHCD in terms of vaccinations across for polio, measles and all that. So we have those platforms and the people that exist, like the minister said, the states and the LG are the implementing arms. So when we started off, we had to start, sensitization of that community, the ward development committees, and also village development committees, and what we call community health influencers, as well as our traditional gatekeepers. They were all sensitized. Equally, we trained the health workers, and we are using these same platforms in terms of educating people on the vaccine and on COVID. So these are the people who are within the communities, and we are doing community polling. And the interesting thing, that community polling showed us, who do you respect in terms of health information? And based on that data, we are now targeting them through community radios and one-on-one targeting, because most of them might not have a TV to be on live some of these shows, but that interaction, community dialogues, which we have deployed in several campaigns, is what we are using now. And they want to ask questions. So it's not something about hearing, but they want to ask about this vaccine. What is it? They have so many, you hear people call virus, they have all kinds of names for it. And we try to explain using pictures and whatever we have, IEC, that is targeted at different levels of, our people to pass on that information. So I think the communities are what we are stepping up. And when, our ED, Executive Director, Dr. Faisal, when we had Johnson & Johnson, he also did say that we are looking at those very hard to reach populations, in terms of one dose and you're out. So we are planning with them, doing a micro planning and ensuring that these are the people we are going to use the J&J on in terms of the hard to reach.
Okay, right. That's what I was going to find out. What's the advantage here? I mean, at first people were worried about whether or not Nigeria had the cold chain to keep these vaccines for long periods, given weather conditions. Is there any advantage that one vaccine has over the other in terms of how it's kept before it's dispensed?
No, we expanded our cold chain to mean that we are prepared, and I think the federal government made sure we had the UCCs and as well as the refrigerators, and people are trained up to that. I think the ease of giving one dose and you're out is what instigated that, not because we cannot keep the vaccine. One dose and you're out. How many people have received the first dose, how many come back for the second dose for one reason or the other. But these communities, we get them and we give them one shot, you target them, and you're out. You don't need to go back again. I think that is a reason.
All right. At this point in time, we'll take a short break. When we return, there'll be more on tonight's issues, and hopefully we'll take your calls. Stay with us on NTA Tuesday Live. We'll be back shortly.
It's another season of Caros.
Radio Nigeria, NTA, and Voice of Nigeria invite you to their annual service of 9 lessons and carols.
Theme: Peace, be still.
Come and enjoy the ministrations of Radio Nigeria, NTA, Voice of Nigeria, and other choirs.
The message will be given by the Most Reverend Dr. Ignatius Kaigama, Archbishop, Catholic Archdiocese of Abuja.
And lessons will be read by notable Nigerians.
Chairman, Mr. Boss Mustafa, Secretary to the Government of the Federation.
Special guest of honor, His Excellency Professor Yemio Shimbajo, Vice President, Federal Republic of Nigeria.
Chief host, Alhaji Lai Mohammed, Minister of Information and Culture.
Host, Directors General of FRCN, NTA, and Voice of Nigeria.
Date, 5th of December 2021.
Venue, National Christian Center, Abuja.
Time, 3 p.m. prompt.
The program will be broadcast live on Radio Nigeria, NTA, and Voice of Nigeria,
including live streaming on Facebook.
For advert placement, call RATE on 0803 451 2261, Lillian on 0803 314 4383, or Bibiana on 0909 965 1270.
All COVID-19 protocols will be duly observed.
Radio Nigeria, NTA, and Voice of Nigeria Service of 9 Lessons and Carols 2021.
Supported by Vivid Sounds. Come, let's celebrate the newborn king.
I am more than just an idea. I am alive, connected. I am part of an ecosystem, creating connections within an interactive and sustainable city. I am intentional about excellence, integrity, and efficiency. I am invested in building a sustainable future. I am committed to strategic partnerships and collaborations. I can be tough, and I can be tender. I take pride in delivering high standards. While there may be others, I am in a league of my own. I am more than just an idea. I am Bilal. Who are you?
Tuesday Live, a network issue-oriented innovation talk show.
Thanks for staying with us. At this point, at this segment, the phone lines will be open. You get to see the numbers on your screens, and which means you can take part in this discussion. As usual, we refresh your memory. The guidelines, of course, are straightforward and simple. If you call in and your call gets through, turn down the volume of your TV set. It's better to do that so we avoid the hurlback or the echo. And again, we remind you to go straight to the point. Don't worry about greetings. Just go straight. And whatever issues you raise, guests will address them as we go on. So thanks for still being with us here. We have Dr. Mukhtar Mohammed, Technical Head of the Presidential Steering Committee on COVID-19, still here with us in the studio. And Dr. Mohammed, this what's been referred to now as vaccine politics. It's a big issue all over the world. The big countries have so much, and the struggling countries don't have nearly enough to go through with it. And so people are saying, look beyond and start manufacturing vaccines. What's standing in the way of countries like Nigeria going into vaccine production?
I will say a lot, but we say that if you aim to reach the sky, if you stand on a block, it's just a starting point. Vaccines cannot be manufactured overnight. It takes a long time to invest in research. It takes longer time to build in the capital, the resources, human resource investment that you need to make, which to some extent I would say that those are quite available in the country. However, doing research itself requires a lot of money. If you take, for example, the COVID vaccine, when the private companies, the companies producing the current vaccines wanted to go into the research, or when they started doing the research, there was a lot of funds that was injected by these so-called developed countries. There were uncertainties. They were not sure if they were going to succeed or not, but yet they invested a lot of their dollars into these companies to get the agents. And when the vaccine was produced, the government also, these governments didn't want to lose. And therefore, they helped whatever they could to perfect that vaccine. So for Nigeria, yes, we have started. Honorable Minister of Health has brought a team together, and we have made some significant investment with the private manufacturing company in Nigeria, and they got some initial funds to begin what will be like the preliminary stage of developing local vaccines in the country. Apart from that also, we are in touch with many other groups. Professor Tomori here has been in touch with other groups of scientists who are also trying to develop their own vaccines. But what is lacking is the resources that they need to be invested into this, to develop them.
Let's quickly go over to the phone lines now. We have a caller from Lagos, Peter calling in from Lagos. Hello, Peter, go ahead.
Thank you, Mr. Stober. I've been another about the. I have listened to 5 different people here, and each of them has spoken from one perspective. In terms of communication, Mr. Stober, that is not right. You ought to get 2 people who have different, everyone promoting nations and making some statements that are not verified, not verifiable. You need to have at least 2 people from another side, people who don't approve the taking of the state. That is my first point. My second point, I have a 40 article of the if I know how to get you, send it to you because I cannot say all I have in that 4 years. My third point is this. Professor Tomori and Ms. Noble have talked about misinformation. Now, there is nothing that is misinformation. It's saying that COVID, the things have the fears.
Peter, unfortunately, your line isn't very clear, and we've been straining here to get it clearly. What we can do is why don't you try calling in again, and let's see if it will be a lot clearer than now. The line hasn't been very clear at all. I'm sorry, but could you just try? We need to hear what you have to say. So try again, and we'll get back to you and see if we can get your calls through. Okay, well, Doctor, on the subject of looking inwards, and a lot of Nigerians are saying, why not? Yes, it's expensive, but we are the giants of Africa, aren't we?
Yes, we are. And a few years ago, Professor Tomori, I think this discussion came up about vaccine production.
Right.
And that was when we were doing yellow fever. We did recall that we were producing yellow fever vaccine here in the country. But things have moved on, and there's a lot of money required in terms of, even the infrastructure that we have. And I think Dr. Mukhtar has raised an important issue in terms of resources that are available for such, because science has moved on. You see how fast, the Ebola vaccine is out. There's a lot of testing and that research that requires to be done for these vaccines to be done. So it's something we need to do. It's something Nigeria should do. As a giant of Africa, we should be producing our vaccines. And I think the government, Honorable Minister, putting together a team, as well as Professor Tomori and their science, there's a lot being discussed. And because looking at health security, we should be able to produce our vaccine. Who knows the next pandemic? Who knows what will happen next? I will be caught with our pants down. So I think government, and I hear as Dr. Mukhtar said it, that this is something they are looking at, and then going forward, we will, have vaccine production in the country.
Okay, back to the phone lines. We have Mia. This call is also from Lagos. Mia calling in from Lagos. Hello, go ahead, please. Yes, go right ahead if you're with us.
Hello?
Go on.
Yeah, hello. Hello? Yes, Leo from Lagos. Hello? Yeah, the issue of this COVID-19 is something that, hello, are you hearing me?
Yeah.
Okay. It's something that we all believe, but in another way, they feel confused because it just as if both the government and the masses, the people so concerned and feeling, because they say before you enter even a hospital or a banking sector or an office, they will force you to use the nose mask. But at the end of the time, at the end of the day, when you get inside, none of them will use those masks. They will stay social distance. At the end of the day, when you meet them in the office or in any organization, gathering, and something like nose mask. So I don't really know if they're feeling us in one way or the other. That is what I just try to Thank you.
All right, thank you very much. Unfortunately, tonight the lines are not very clear. We could barely make out what the last caller, Mia, was saying from Lagos. We still expect that the first caller, Peter, who called in, will call again, and so we can get through to what he has to say. But we have a couple of more reports to go, and let's take this one from Enugu. It's by Chineye Nwuye.
So I want to encourage everybody in Enugu State to come and take this vaccine.
Okechukwu Obodo is one out of many Nigerians that perceive taking the COVID-19 vaccine as important and a good option for prevention against the deadly coronavirus disease. Since Enugu State recorded its first case of COVID-19, it has adopted several measures to prevent the spread of the disease, including vaccination, especially with over 2,500 cases. Massive sensitization by key players in the state to help prevent further spread of the disease has yielded positive results and has helped dissipated vaccine hesitancy.
If you look at the acceptance of the vaccine in the state, it's been on the increase. At the initial stage, people were afraid. People thought the vaccine may not be safe, or people thought it will cause all sorts of strange possible complications. But we explained that all known health authorities have declared this vaccine safe and free, and is being used across the world.
With over 120,000 people already vaccinated in Enugu State, more persons have been encouraged to go into any health facility in the state to take their COVID-19 jabs. Though the state has not recorded any case of the Delta variant of the virus, residents are advised not to let down their guards, but to continue observing all the COVID-19 safety protocols, especially with the new COVID-19 Omicron variant assumed already in some countries. It is hoped that with the December 1st deadline given by the federal government for all civil servants to get vaccinated, the target of getting 80% of Nigerians vaccinated would have been achieved.
Well, okay. I think we have Professor Tomori with us now. Let's go back to the issue of vaccine politics, as I couched it. Earlier on, I asked Dr. Mukhtar Mohammed what's standing in the way of local production of vaccines. And, Professor Tomori, you've always been at the forefront of this. And let's come to you and hear you on this matter.
Thank you very much. It's a sad story, and we must tell ourselves the truth about what is happening. Nigeria was producing vaccine before, as always said, Nick has said. Even right now, in VOM, they've been producing vaccines since 1924, and they're still producing animal vaccines. We were producing, in Yaba before, up to about 1990. An attempt was made to upgrade the space, and then we ran into problems. And part of the problem we ran into was with change of government and change of policies. Each of the subsequent government that came in, military, civilian, totally abandoned vaccine production. I think these are messages I think we need to learn from. Many of the countries where you're having vaccine production, there have been years of consistent and persistent investment into vaccine production, together with the private sector. I think these are things we need to begin to look at. How did they manage to achieve it? And then one other issue that I think is a problem with us in the African region, which is the fact that unity of purpose. I was a member of the African Vaccine Manufacturers Initiative, in which the AU at Serena came up with, how do we produce vaccine? And they look at it's a business, so let's not forget about it. Apart from the complication, it's still a business. And therefore we say, how are you going to sustain it? And the only way to do was to say, okay, rather than every country producing vaccine from this thing, let's have regional hubs for vaccine production. There's Dakar yellow fever, Nigeria this, South Africa that, and then all of us in Africa will buy. But that's where it ended, because that political unity was not there. We are still unfortunately tied to our colonial masters. And so when Togo wants to buy vaccine, and he doesn't have the money and goes to France to go and get it, France will pay the money to their factory and then bring the vaccine to this. So defeating the whole purpose of African unity. We need to come together as a united front in the African region and look at our market. The market is becoming a problem for us, which they're exploiting, and we're allowing them to exploit it. So back home, why have we not produced? Again, I keep making the point that it is not that we don't have the resources, it's not that we don't have the people, but somehow we have not been able to bring all this and tie it together as a nation. To get all these vaccines. I used to say one thing, that sometimes I think we allow self-interest to override our national interest. And I think that's one of the major issues we need to begin to address and look at as in institution of vaccine production. We can get it done. We are already making steps, but we are moving far ahead of it. But then let's come back with one united voice so that we can get this thing done for the sake of the country, for the pride of our nation.
All right, let's get back to the phones. We have calling in from Kaduna, Imario, if I'm correct. Hello, if you're there with us, go right ahead.
Yeah, I'm here. Good evening, Mr. Stober and everybody.
Right.
I don't know if you can hear me very well.
Yeah, sure, go ahead.
Okay, yeah, my question really goes to the Minister of Health in regards to, how people should be vaccinated about the orientation. First of all, you are meant to orientate people to get vaccinated instead of threatening them. For example, now they're giving deadlines to civil servants when they should be, deadline for them to be vaccinated or they lose their job. That's not the approach. You have to come from a very soft pedal where you encourage people to go for vaccination. It doesn't have to be only for civil servants. So my question just goes directly to the Minister of Health, why civil servants are they shouldn't be threatened instead of be encouraged. Yeah, they should be encouraged, just like every other Nigerian, because the facilities are not even there to cater for everybody. So I don't know if this is going to be stepped down, or go ahead. Like I said, you should encourage people instead of for them to be threatening of their jobs and everything. Yes. So that's my question. My question just goes to the Minister of Health. I don't know if that will be very necessary at the moment.
All right. Thank you, Mario. I believe that we have the minister right here. A few moments ago, we had some issues with his Zoom connection, but I think he's back now. Minister. Okay. Can we get that link up again?
Can you hear me?
Yes, Minister, go ahead.
Okay. In the first place, there is no threat being issued. Nobody is being threatened with anything. And the government is also not using this as the only tool. There's a lot of campaign going on there. The Presidential Steering Committee issue statements every time. And I mean, there's a lot being done to convince people to go for their vaccination. And the main reason is that with the vaccine, if you're vaccinated, I mean, you definitely need to be able to protect others. If you get infected, you have no symptoms, you go into an office, you might be working with somebody who has diabetes or who has space can be very tight or who has a comorbidity of some sort. And then this person who is not vaccinated, who is probably also infected and without symptoms, can be a threat. So there's a kind of connectivity there, which even the private sector, if I was giving an example just now of a restaurant. If you own a restaurant, you have a right to say, well, sorry, I have my clients here. If you're not vaccinated, you cannot come in here because you need to look after the interests of your clients. So the government also says, well, we think you should get vaccinated because there are a large number of workers here, and many of them work in very close proximity to each other. And therefore, unless you get a vaccination, really, you can't come to the office. So that's not a threat. It's just giving you the options. And you can say, good, I don't want the vaccination, I'm resigning. It's an option also. But that's not what the government wants to do. It doesn't want to compel you, but it has to work for the interests of the entire country. We are aiming at 70% minimum vaccination, and the way it looks now, will probably require more than 70% vaccination coverage. And while you are doing the jingles, you have to apply other measures that help you get to your destination. We have already reported that we are very far behind. We are slow. We are about 6% or just over 6.5%. You begging and pleading. We still do that, all right. You can't rely only on begging and pleading as the only way to get your vaccination done. You have to take measures and say, well, look, if you don't want to cooperate, well, choose. We have people to protect. And that's why international airlines will tell you, sorry, if you haven't got a negative. You hear that Emirates has not been coming in here because there are issues around that too. In them saying, if you haven't been vaccinated, you can't come in my plane. In fact, they're requiring 2 tests, and the vaccination and 2 tests before you come in. So you do have obligations, and it's keeping those obligations that we take these measures. They are not punitive. They are not threatening. They are not threatening. And every citizen should realize that they also have a responsibility, a social responsibility for their country and fellow men.
Okay. All right, thank you, Minister. Back to the phones. We have Uche calling in from Delta. Hello, Uche. Go ahead.
Yes, Uche from Delta. Good evening.
Good evening.
Please, my question goes like this. I have a few boys that work. Hello. Can you hear me?
Yes, go ahead.
Okay, I have a few boys that work with me. And one of them told me that he went for this injection vaccine. And then he was told because he had HIV that it's not possible for him to take the vaccine. Is it safe for HIV patients to take this vaccine?
Okay.
That's my question.
All right. Thank you. Straightforward. Yes. The last caller, Uche, says, is it right for someone with HIV or someone who's HIV positive to take the COVID vaccine?
Yes, somebody with HIV should take, because already the immune system is quite low, and they're more prone to. If you read more about the Omicron, you'll find out that actually, is the mutations within people who are immunocompromised, or where you have people who are not fully vaccinated, that you have these variants that come up, and we need to protect them because already they have HIV, and they also need to protect them against COVID, so they can, and the advisory is that they can take the vaccine.
Okay, so it's safe for people with
safe.
For others who might have other conditions as well.
What condition? It depends. Because I've heard about pregnant women. And when we started, the pregnant women, yes, but now pregnant women can take.
Okay.
But risk also varies. And we do say where the risk of pregnancy and all, that you might need to consult your doctor. But the science behind it says that a pregnant woman can take the vaccine. But it depends on, you weigh your benefits against the risk. And then when do you take it?
I suppose when you say pregnant women, that also goes for women who are breastfeeding.
Yes.
Okay.
Yes.
All right.
So the vaccines really are not, they are not life attenuated vaccines. Most of them are other vector vaccine. So they are not the real viruses that you say if someone is immunocompromised, you take the virus, and then the virus can start causing disease in you.
Okay. We have another report from Port Harcourt. This time it's by Ijoma Uweke.
Nigeria is taking a cue from other countries of the world in engaging different sections of the populace to establish the safety and effectiveness of the COVID-19 vaccine. As expected, the directive has been generating debates and controversies, with some concerned citizens advocating that Nigeria should seek ways to convince the citizenry on the merits of the COVID-19 vaccination while making the vaccines available.
I have taken the first one. The second one, I would have taken the last two, but it's not available. I went to teaching hospital, it's not available. I'm not against people taking it.
Ordinarily, the government needs to educate people on the benefits of getting vaccinated.
As the ultimatum for all civil servants to receive the COVID-19 vaccine draws nearer, vaccination centers in Rivers State are receiving progressive reports, while there are fears that some are likely to cut corners in order not to be shut out of their offices. Some authorities at vaccination centers have assured that the processes of taking the jab does not permit any sharp practice. They said government should ensure adequate measures are put in place to check authenticity of cards presented by workers at entry points.
The fact is, once you get your card and you're vaccinated, at the gate, you ought to have a machine, a scanner. Even on your phone, you can use a barcode to scan to show that you've taken. At this point is where, if there's a sharp practice, it will affect everybody.
While the mass COVID-19 vaccination campaign is on in different quarters, emphasis has been placed on compliance, enlightenment, and availability of the vaccines.
Okay, we'll check some issues that were raised in that report, but first let's get to the phone lines. There's Christopher, who's calling in from Benue. Hello, Christopher.
Yes, I'm still on the line.
Right. Go ahead.
Oh, all right. I want to ask, why is it very difficult to create a website when it was time for palliative? But now for vaccination, it becomes very easy for the government to create a portal for people to register for vaccination. So I want to get a clear reason why it was very difficult for government to create a portal for palliatives for indigenous to access, but it's very easy for them to create a portal to register for coronavirus vaccination. Thank you.
All right, thank you very much. And okay, so we'll refer to the report which we ran before Christopher called in from Benue. We've taken note of his question. We'll come to that. But Dr. Mukhtar Mohammed, we had one of those who spoke in that report saying he took the first dose, and when he went for the second dose, it was not available. Do you have scenarios such as that?
Well, I think this is more appropriate for NPHCDA, yes.
So normally when you take the vaccine, you're given your date when to come back for the second one. Possibly he went, but really we have a center, we have strategic team meetings, we track vaccines across the nation, even to the facilities, because we have meetings every day. I'm sure by now maybe they are just closing up a meeting. So we know every facility should have a vaccine. Maybe he went when, maybe they sent him back because it wasn't his date, because we do have vaccine. But we had times when maybe there was a short supply. And I remember some states, and it's being sent from, our strategic store, which is at the zonal level to the state. Maybe the time in which it arrives, may be the issue, because I'm sure if he went the next day, there'll be a vaccine, because he has to go back to the site where he was vaccinated. But it's really very rare, because we provide, there's a micro plan for every day with vaccines.
Good. We still have to come to you on that, because this borders on whether there are enough vaccines, if the vaccines are adequate. Because if someone says, I went for the first time, the second time it was, the suggestion here is that perhaps the vaccines are not enough, and that's why we'll come back to the Presidential Steering Committee to say.
Yeah, actually, the vaccines did not all come at once. We got them in batches. They were coming. Truly, there could be periods when people who have been vaccinated may go for their second doses either earlier than expected or later than expected, and they may be advised by the health care workers that they should come back on so date. But it is also possible that specific sites may run out of the vaccine. But as Dr. Onka mentioned, it may not be for a prolonged time. It may be for a few hours, maybe a day or two, and then they'll get restock of their vaccines. But right now, as Honorable Minister of Health has mentioned, we have a guarantee of pipeline of vaccines. What we have in the country is sufficient enough for every state, for every local government, and we still have more than enough in the pipeline. If you heard the Honorable Minister, he mentioned that we have almost 100 million vaccines in the pipeline, which we can just, by a snap of our fingers, will be brought into the country.
Okay, Professor Tomari, if you're with us, let me come to you on this matter of how viruses behave. For instance, one person says they took first dose and they didn't take the second. From how viruses behave, is it, tell us, one who takes a first dose of a vaccine and doesn't go back, what happens about their immunity after having just one jab?
Thank you, Cyril. The vaccines, the viruses differ, so also vaccines differ. Some you require only one dose, others require 2 doses. Take the one for the children, you multiple vaccination like polio 1, 2, 3. And so vaccines will differ. But for each one, there's a specification. You need only one dose. Johnson & Johnson, only one dose. The others, maybe 2 doses. And so that means, so there are specifications. If you need 2 doses, you must get 2 doses before you can get your full protection. Now, you remember in those days where you used to get the yellow fever vaccine, sometimes they said for 10 years before you come back for it. So also each vaccine, how long the immunity drops or wanes differs from vaccine to vaccine. I think that's one point I think people should need to know. But each manufacturer will tell you you need 2 doses. But I think one other important point, which is also important for what we're saying, the fact that you got your vaccine today does not mean your immunity develops immediately. The body has to take time to develop that immunity. And in fact, they say anything from 10 to 14 days after you get your vaccine, that's when you develop immunity. Which brings me to the point of the plan by the government to start vaccinating people in the offices. You have to let those guys know who get their vaccine in the office, that the fact that they got it that day does not mean they can go to work on that day. They have to have that period before they develop immunity. Yeah, these are important things. So it's a matter of the virus. What about virus and what about vaccines and the type of vaccine? And each one has the specification. But you need your full dose according to the manufacturer's specification to get your immunity. Also remember that it is not the day you get the vaccine that your immunity comes up. It takes some time, anything from 10 to 14 days.
All right. Thank you, Prof. Back to the phone lines. We have Lucky, who's calling in from Edu. Lucky, go ahead. Lucky, are you still with us?
Yes.
All right. Okay, go ahead.
Thank you, Mr. Singh. So, this COVID vaccine, we are very worried. Majority of people are worried
about how Nigeria actually tested the viability and the quality standards of the vaccine to administrate our populations. I think it would be wise for us to be able to showcase the laboratory where these vaccines were tested the moment they entered into our country. It's not by just bringing vaccine to the airport, from the airport, delivering it to all the staff, everything, to administer to the populace. That is one. And two, what are we sure that this vaccine in the next 3 years will have a negative effect on our people? So these are salient issues I want us to, the ministers and the state committee, to look into, and the medical doctor. So I think Nigeria needs to know that's why people are hesitating to take the vaccine. Thank you.
Okay, thank you very much, Dr. Nika. Well, this goes back to the hesitancy,
So hesitancy is something that is global. So I was just wondering, if we didn't have this because of smallpox. Some of us, our fathers took that smallpox vaccine many years ago, and that is why Lucky, and I don't know who called in, can talk now. So the issue of vaccines, they are safe. We have NAFDAC here, and those vaccines, once they come in, they are tested. And like Prof has said, there are so many labs that are sequencing and looking at these vaccines. So we didn't just take it off, the block like that. And you recall, we've been doing vaccination in this country as far back as I can remember. We are giving our children vaccines. They are coming from the same labs. We are not producing here. And it's safe and it's tested. I don't think any government or country would want to, harm its own people. What we are doing now is to protect our people. And we are asking people to be vaccinated to make sure that we don't make our children, start crying because they've lost us. Let our loved ones not start crying because they've lost us. The vaccines are safe, they've been tested, and I don't think any country would want to do that to its citizen. So please go take the vaccine. It will protect you and your loved one.
Okay. At this one, let's see if we can re-establish those links with the minister once more. Minister, if you're there. Well, I think it was Christopher who called in from Benue and says he was trying to find out that the ease with which the government responded to the issue of vaccination, and it was not that swift in palliatives, in giving of palliatives. Perhaps the minister would like to comment on that, and as well the same old fears about the safety of these vaccines and what it can do to the population.
Well, beginning with the second point, the vaccines are as safe as can be. They are the product of research, and from the information we have, many of these vaccines, particularly the mRNA, were not really starting from scratch. They have been working on that concept for some time, and they had the groundwork. It's like if you are preparing a soup, there are some of the ingredients you already have in a house. And so it was not like they started from scratch. And the urgency of the situation, the rate at which people were losing people, and the fact that all the medicines, the therapeutics we thought we had, didn't turn out to be so reliable, whether it was hydroxychloroquine or Madagascar herbs or whatever it is, all those ones didn't turn out to be as reliable, as helpful as we thought. So there was an urgency for the vaccines. And in fact, it was Russians who were the first to say, yes, they have got their vaccine ready. And in August, they started injecting. Then others followed. But up to now, we see that on the whole, there's a lot more good than harm. There are a few cases of what they call adverse effects following immunization, but the total effect is shown in graphics that out of the large number of people who are vaccinated, those who are the very, very, or those who lose their lives are those who have not been vaccinated, majority. So the fact that those who are vaccinated, even if they get sick, do not get seriously sick, and their lives are saved. So and then all the treatment that you give to persons who are infected with COVID-19 is at public expense. The state pays for it. So again, actually, is the state also can request that please take this back. If you don't take it and you get infected, it will cost us a lot of trouble to look after you, a lot of money. It's a state expense, really. And the safety is, again, reassured when you see that the president, the vice president, the ministers, they have taken these vaccines and they're still doing their job. They're taking first dose, second dose. So everybody is doing their job. So what other proof do you really want? And but again, I acknowledge that this is not peculiar to us. Or in other countries, they argue the same thing. In some countries where they just argue and say, well, it's my freedom. I'm free to do what I like. And they can't compel me. Well, there are countries like that who take freedom, personal freedom to a certain extent. But the others who have what we call hesitancy is not really fear, but they're just, for some reason, skeptical, vaccine skepticism, that, well, how are we sure that it do not have some effect in 3 years' time? Well, why worry about today? If you don't take this vaccine, you might not even make it in 3 years' time. So the question, if that person is hypertensive or has some other serious illness, he might not even make that reason if he doesn't take it. So that is not a reason to refuse this vaccine. And again, I want to use this opportunity to urge everybody, take the vaccine. Most people have taken it and they are fine. And we need you to help us get to that zone that we're looking for herd immunity as calculated by scientists. Now, the other one about swiftness, well, you must understand again that these were extraordinary circumstances we faced during the lockdown. When you're talking about the palliatives, all those things that had to be done in a hurry, and many things were improvised. So you can't really compare one situation to the other, how quickly palliatives were given, how quickly the vaccines are being done. It's difficult because you are responding to the very best of their ability, and know that the SARS-CoV-2 virus was called a novel virus. Novel because we didn't know everything about it. We didn't know its behavior. And there are many things which we did at that early time, which today we will not do, because we have learned that those were not very favorable moves. So we know better today. And perhaps in a year or two, we know even better than we know today. So the reason is not really helpful, and the government tried to do all it can at every given situation to respond to the urgency of the situation, which nobody had prepared for.
Thank you, Minister. But back to the basics now, the advisories on how people should conduct themselves, which the Presidential Steering Committee has always been churning out. And the use of face masks and the washing of hands, they still remain key. I mean, sometimes you do get people who do not want to take the vaccine say, why do I have to take it if I don't have guarantees that if I take the vaccine, I won't be infected? So, I mean, why not just go ahead? And some who take the vaccine and say, well, I've taken it, there's no need to be cautious anymore. Goodbye masks, goodbye hand washing and things like that.
So absolutely, these are the critical questions that the public needs to understand. You wear a face mask, you wash your hands, you practice social distancing because you want to prevent yourself from getting infected. You cannot completely say that doing this alone will protect you completely 100% from getting the infection. There are still chances that you may not wear your mask properly. There are still chances that you may not sanitize so frequently, and you can touch your eyes or touch your nose or touch your mouth, and you can get infected. That is why vaccination remains the key to the prevention. You get vaccinated, and yet we say there is a chance that you will get infected. But when you get infected and you are vaccinated, the chances of you coming down with the disease is much lower. The risk of you getting hospitalized and having severe infection is much lower. The risk of you dying from COVID-19 is near zero if you are fully vaccinated. So there is difference. Most of the cases we see nowadays are people who are unvaccinated, and therefore they get hospitalized more, they get more severe condition, and a lot of the death that we have, in fact, all the death we have, nearly all the death we have in the country are largely people who are unvaccinated, not only in Nigeria, but in most parts of the world. So certainly there is advantage for wearing masks and sanitizing and doing social distancing, and that is a greater advantage in getting vaccinated and still practicing these procedures.
Okay, let's go over to Professor Tomori, who's still with us there. And Prof, this part of it has to do mainly with the vaccines and the kinds of things it does. If you can make us understand, the virus itself. It said that Omicron, already has about 30 mutations, I guess, and this is what viruses come up with. First, you have a variant, and then that variant has a mutation. And explain that to us, will you?
Thank you very much. Let me, just before that, I wanted to add on to what Mukhtar said about vaccines. I think we need to know not to ascribe to vaccines what was not designed for. Vaccines are to protect you from getting disease, infection, to protect you from your infection becoming severe disease. Vaccines will not stop you from exposure. Just like when you get your yellow fever vaccine, it does not stop the mosquito from biting you and giving you the yellow fever virus. That's your business, to get the vaccine, to get the mosquito out of your area. So we have a role. The vaccines are just an additional ammunition. Now, people should need to understand that and not ascribe to the vaccine much more than it was meant to be. That's just a point I wanted to raise. Back to the question you raised. Just as we are talking, something just came to my mind. Where are the variants coming from? We have looked at it. If we look at the world, China that had the original thing, how many variants has come out of China? Where are the people getting the variants? And you have noticed that these are countries where people are socially, sorry to use the word, irresponsible, who will not use their mask, who are busy transmitting the virus. And that's how viruses mutate. And a virus is as dead until it gets into somebody's body. And if you continue to spread it from one person, it begins to multiply. It's adapting to survive. That's what the virus is doing. And in the process, if you get to somebody who has maybe a little bit of immunity, that virus tweaks itself into a way that it overcomes or evades that immunity and becomes something else. This current one that you're talking about, they found that actually it was in somebody who had an HIV problem, who has been, who has this immunocompromised. And therefore they found mutations, similar mutations to what was in Delta, additional mutation on virtually every part of the virus, from the spike to even that point you call the receptor binding sector, which attaches to the cell. There are changes that I've called in there. And this was made possible because we have allowed the virus to move from one person to another and then become what it has become. It's not every mutation that is dangerous. Sometimes the virus will mutate itself and just die, not like that. But occasionally, some come up and become so different. Like one of the things that the ability to attach even firmer, much firmly, the ability to spread. These are all factors that occur when the mutation occurs. But none of us can predict the outcome. And that's why it is important to prevent the spread of viruses or this virus so that we reduce the mutation. Again, I go back to the first question I asked. Where the countries where they abide by their we call it communist country or whatever, where there are rules and regulations, wear your mask, they sanction you. How many variants have come out of those countries? I think this is a question that people should begin to look at. Over.
All right. Thank you so much, Prof. Dr. Neka, we're still struggling to get a reasonable percentage of the population to be vaccinated here. Some countries have gone ahead and introduced boosters, then the third vaccination, which also suggests that perhaps after some time, the vaccines may no longer be efficacious. So you would need, I don't know what you call them. You would need to take a booster, but we haven't reached that stage yet, have we?
No, we don't have the advisory yet for the third dose, but I'm sure based on science and advice from Presidential Steering Committee, should we require such, then we will do so. And like you said, some of the, not that it's no longer, but the efficacy reduces, drops. And that is why you give a third dose. And like we've said, there's a lot we are learning about this virus and then going forward. And it's based on this learning that we have now gone ahead to say, some countries have started the booster dose for a certain age group or certain population because they've studied and they've seen that the immunity wanes. It doesn't give you that level of protection that you require, for you to at least be protected as is required. And it's all based on science.
Yes, speaking of that, now you just mentioned that, and the age. Now in Nigeria, what are the ages that we're looking at here who should take this vaccine?
We are looking at 18 years and above. I know some countries, based on science, based on their research, have also gone down to a lower age group, because I think in America they found that school children also had, based on the tests they were doing, that they needed to protect this level of the population, and that there was nothing, the vaccine wasn't really going to be affect them in any way. Rather, it was going to boost their immunity and reduce the transmissions that we're having. But for us in Nigeria, for now, the advisory we have from the Presidential Steering Committee is 18 years and above. And I'm sure going forward, based on science or anything that we learn going further, will also we may have to step down to another, a lower age group.
Okay. As we wind down this program, let's see if we still have the Minister of Health there to give us his last thoughts on tonight's program. Minister, if you're there, we're winding down now. What would you say to Nigerians?
Thank you very much for the opportunity. What I will say to Nigerians again is to cooperate and accept the vaccine for your own sake, for the sake of your family, for the sake of the community, and for the sake of the country. We are facing a lot of challenges, and the challenges we have been trying to discuss today, which include even the access to the vaccines, the money to treat those who are sick. We are building oxygen plants. We're doing a lot of things and looking for therapeutics, increasing the beds, ICUs. All this we are doing for Nigerians, for our citizens, and anyone who is unfortunate to be badly affected by the COVID-19 and gets badly infected and has to be treated fully at the cost of at cost to the government. What they can do is also cooperate to make sure that not so many people get sick by accepting the vaccine. Secondly, to agree to conduct the non-pharmaceutical interventions, to participate in public health measures that require you to wear a mask, social distancing, and as we go into the festive period in December, which is beginning next tomorrow, this morning, that we are not out of the woods. We just seen a scary virus come up now, which again, we just heard this evening that this virus was actually isolated in the Netherlands before South Africa, before it was noticed in Botswana. It had actually been in Netherlands. But again, if it is not turning out to be as virulent as we feared, we haven't heard of mass fatalities or in fact of any fatality yet, so we might get away with it. But never, there will be more variants, and we must take measures to protect ourselves, protect our citizens. Simple measures: mask, distancing, sanitizer, and all the other measures that have been advised. Over, and thank you for the opportunity.
All right, thank you very much, Minister Dr. Sagi Haniri, Minister of Health, who joined us via Zoom. We appreciate you being with us on this program tonight and sharing your thoughts with us. And that's just about what our program tonight. Let's turn to Dr. Mukhtar Mohammed, Technical Head, Presidential Steering Committee on COVID-19, in seconds.
Thank you very much. I think I will toe the line of Honorable Minister. Right. This job is really more than what the government can do. we should look inwards, what everyone can do to the community. If you are vaccinated, get your neighbor to get vaccinated. It is responsibility that is on every one of us.
Okay, yeah, Dr. Nekanwu.
Before I to the line of the Honorable Minister and that of my colleague, the Presidential Steering Committee, that we should get vaccinated. The sites are there. We've expanded, and there's nothing to fear. The vaccines are available, and if you get vaccinated, you protect not only yourself but your loved one and your community, and that way our economy will open up and we start moving around again.
Prof, in some 10 seconds, what you have to say to us?
Oh, that's me? Hello?
Yes, Professor Tobori.
Okay. Thank you very much. I think one of the things we need to get to our people is that the control of this epidemic is not the government that is controlling the epidemic, it's you and I. It is what I do that determines whether the epidemic continues or does not continue. The most important player in the control of the epidemic is that individual, is you, is me. Play your part. The government has played its part. You go ahead and play your part.
All right. Thank you very much, Professor Iwali Tomori. Thank you for being part of this program. We appreciate your presence here. Well, that's our program today. We thank you for being with us. Next week, we'll be back with NTA Tuesday Live. I'm Cyril Stover, and I say continue to stay safe.